question was how to do, my name is Annette Frost. I'm a program manager for NCBA CLUSA, and I cover our West Africa portfolio in Niger and Burkina Faso.
And I'm Meredith Feenstra. I work at Social Impact doing gender analysis and integration into all of our M&E work.
So our question was how to do an effective gender analysis. And we sort of realized at our table that a lot of us had not ever actually done a gender analysis. So we talked about a wish list of what we would like to see in doing an effective gender analysis. Some of the sort of branches that we talked about were having our gender analysis be goal specific, so actually wanting to implement something that would then be forced to have an implementation strategy afterwards so that it could be incorporated into the proposal, into the actual program itself. We talked about wanting to have it be context specific, so making sure that we were actually going into the gender analysis with the intention of learning something new every time. We talked about wanting better guidelines and sort of clearer communication from the donor around what do they want to see in a gender analysis and sort of how can we fit that into the budget and the project implementation. And we have a lot of examples under this one. We talked about doing trainings at the field level in addition to HQ level. And sort of like a gender analysis 101 from the donor would be very helpful for us. And then we also talked about tools that we would like to see in order to do an effective gender analysis. So we talked about using like the WIA, the Women's Empowerment Index to track the analysis that we do, to track it in the PMP in the project as well. We talked about tools that are already there that we should make more public and utilize sort of freely between organizations. And then we talked about staffing up our projects and saying, when you're staffing up a new project, how can you ensure that you're going to incorporate, gender into the priority level? And we talked also about wanting to then include that not only in the job descriptions, but also in the performance management plan, in the performance evaluations of those staff, so that everybody is required to really be thinking about gender all the time. And in conclusion, we basically said, okay, now what? So how do we move forward with this? We want to have good communication with the donor around what our goals are for this, and we want to have an action plan. We want good analysis during the design, and we want to have a strategy moving with, when we do the gender analysis, a strategy for what is this for, when should we do it, and what are we going to use this for in the long run for the project.
You have 30 seconds left.
Does anybody have any questions in 15 seconds or less?
Let's give them a round of applause. Thank you. Okay, can we go to table 11, Sarah Eckhoff's table?
Thank you. So I'm the default presenter, reporter. Good luck to anyone who works at FHI 360 in digesting this mind map. We had a lot of discussion at our table, which is focused on topic number 3, key populations. And one of the first things that we really talked about is that there would be some benefit to potentially reframing the topic to capture a more broad scope of individuals and groups to those that are both hidden and invisible. Key populations, for those who weren't in this group or are less familiar, traditionally talk about men who have sex with men, transgender populations, injecting drug users, and sex workers. And while these individual groups definitely represent those that are vulnerable and most at risk, it definitely represents a group that are most at risk or vulnerable within an HIV framework or an HIV prevention framework. And a lot of the work that we're doing across sectors in development, we're really thinking about individuals that may be hidden or invisible to a broad scope of different sector investments in development, whether that be agriculture, nutrition, sexual reproductive health, broader health initiatives, WASH, et cetera. So we made it a little bit broader. Within this conversation, one of the things that we really talked about is the intersectionality of vulnerability. And when we're thinking about gender, what we're really thinking about is power. And when we're doing power analysis or gender analysis, one of the key factors or the key elements of doing a successful and comprehensive and broad-reaching gender analysis is being intentional about thinking about some of the invisible and hidden groups within a given context. So while you might have an intervention or a project that's solely focused on increasing access to family planning services, thinking about the broad scope of target populations that may be affected by your interventions and thinking about those hidden and invisible groups. Just a couple of examples of some of those groups that we highlighted are individuals living with disabilities or handy-capable populations, older women who are often completely invisible to health interventions, especially sexual and reproductive health interventions, and then also certain populations, including women who have sex with women or lesbian populations, because they are completely invisible to a lot of interventions that are specifically designed to increase access to sexual reproductive health services because they're not identified as at risk of HIV, STIs, while in fact they might be due to their increased vulnerability of gender-based violence. Moving along, we talked about mechanisms for addressing some of the different factors and themes that are identified during the gender analysis, and sort of different groups and channels for affecting change. We talked a little bit about recognizing that within a socio-ecological model that you need to work at multiple levels, at community level with champions, but also at the policy level, and ensuring that laws are responsive to the unique needs of these hidden and invisible populations. And then if they aren't responsive, what are the mechanisms within advocacy efforts to make sure that they are changed? One of the other sort of buckets that we talked about is the importance of focusing on the assets of these populations and not necessarily the deficits. So thinking about what are their capabilities, what are their capacities, what kinds of development or health assets do they have to have in order to be able to engage in communities and exercise their universal rights. And within that context, what's the difference and what's the gap between universal rights and universal capabilities? So while everyone might agree that because universal health is a right, not everyone has the universal capability to exercise that right. So how are programs being intentional about addressing the deficits in an individual or a target group's capacity or capability to exercise those universal rights?
We have 15 seconds left.
Ready, set, go. Okay. One of the other things that I would highlight from our discussion is the importance of engaging with donors around this and pushing back on funding streams that are prohibitive or non-inclusive of these types of populations. Outside of these integrated health projects, how can we be more inclusive about identifying and recognizing and addressing the unique needs of these invisible and often hidden populations? Thank you very much.
Table 3, are you ready?
Table 3 focused on organizational gender mainstreaming, and we had, of course, a wide-ranging conversation, but we ended up focusing our recommendations in a number of categories: leadership, organizational practice, money, framing and partnership, and of course all of these things, you know, interact with each other. In the leadership bucket, we emphasized support from senior leadership for this work in general, and then specifically, you know, leadership with capacity in gender to take the work forward in the organization. Of course, leadership is linked to money and prioritizing this gender mainstreaming work and ensuring that there's adequate staffing to carry forward the commitment to gender organizationally. And budget and staffing, of course, reflect the organization's commitment to accountability as well. So there's a linking down here. On the framing side, we discussed, first of all, the emphasis on evidence versus the emphasis on rights as an important area, and then the broader commitment to social justice as an important framing, and the need to have critical consciousness. That's what we ended up realizing was kind of at the core. We want our staff, and we want anybody that comes, you know, is engaged in our programs in the places where we work, to develop this critical consciousness, which will enable them to to understand gender inequality and other kinds of social inequalities as well. In the partnership category, we talked about how partners can help us also be accountable for making these commitments in our work, the opportunities to collaborate with corporations, and then on the meta messages side, under partnership, what we were thinking is that there's a huge opportunity, and I think it came up already this morning, that organizations we should be working together to share some joint messages for the field, so not be driven only by our institutional needs and requirements and commitments, but sort of thinking about the field more broadly. Organizational practice, again, we want you know, a politicized staff in the sense of that kind of awareness of the social inequalities and the expectations organizationally on how that plays out in the work that we do, and the need to measure what we value, and of course that's also related to accountability.
Okay. Questions? So I think Meg touched on it, but we had a couple key salient questions that we wanted to highlight for the group. One is the mainstreaming versus siloing. There was a lot of discussion in our group that it really shouldn't be an either or, but a both. And perhaps that's the best way to tackle gender within an organization. Policies versus implementation. For organizations that are sort of struggling around which way to go, you know, what's the most bang for your buck? Is it a gender policy, or is it integrating into HR, or is it integrating, you know, directly into staff and the culture and program? So where do you really kind of edge your bets? Meg just touched on this, and I think this idea of competition as organizations, and how do we sort of move away from that to really the shared best practices and sharing as a community. So that's one of the things that also came up. And then Meg already touched on the data versus rights-based approach. There was a healthy discussion in our group about, you know, even what happened with Secretary Clinton, and the data initiative that she's pushing is fantastic. And also, what is the discussion around the RBA approaches, and how do the two meet? So I hope we did it justice, group. That's it.
Thank you very much.
Thank you.
Table 23, Vicki Stein's table.
Thanks. I'm Naomi Brodke, and I am co-representing the role of donors in achieving gender equality with...
I'm Sarah Neely. I'm also co-representing.
So I think one of the things that we discovered, and if you can see the map, the dotted lines represent, is that there's a lot of intersectionality between all of the different things that we tried to capture, but we tried to break it down into 4, which were communications, modeling, capacity, design planning, which are all linked to the different things spread out with the different shades of lines. So under communications, we discussed power dynamics between the donor and the implementer, But power dynamics also can fall into expectations, which would be the expectations of the donor towards the implementer, but vice versa as well. So expectations from the implementer on what to expect from the donor. Flexibility is something that we tried to highlight throughout and connects to all of them, but especially communications and design planning. And in that, we might go to design planning and talk about the outcomes and focusing on the outcomes, but at the beginning, even responding to the RFP, the RFA, developing and changing priorities throughout, but still focusing on what the outcome should be, but being flexible in how that outcome might come about.
So on this side over here, at the top we have modeling, and that was really that donor organizations should model internally and externally gender equality. So various aspects such as having policies, conducting gender audits. We have training staff down here in capacity, but making sure your staff is fully trained up on its own policies as well as how to integrate this. Also down in capacity here, the donor has the ability to provide a specific level of capacity building. So having local and headquarter gender experts that they can employ. And then also we have connecting capacity and design planning, gender analysis, and defining gender overall so that those can take place at the donor level and help infuse throughout this, all these different areas.
This may go without saying, but we decided to include it anyway, understanding the local context, which echoes what some of our other colleagues have already said. And with that, advocacy, which ties to communications and modeling, as well as highlighting success stories and not only focusing on the outcomes, but also along the way, how we got to those outcomes. And of course, collaborating on the definition of success so that as we're going, we understand what success stories actually represent. Oh, and at the very bottom, tying to all four sections, is culture change in every aspect of the work that we're doing.
Thank you very much. Table 5, Debbie Caro's table.
Hello, everyone. So we got to
sorry, can you introduce yourself?
Oh, I'm sorry. You don't know me, do you? My name is Shelby French, and I'm the Adolescent Girl Program Specialist with the IRC's Women's Protection and Empowerment Unit. So we had the wonderful discussion around measuring gender equality, and our conversation went from one end of the continuum where measuring gender equality is hard. It's really hard. Just finding the definition of equality in multiple locations is difficult. All the way to measuring gender equality can be your best friend, right? What better way to be able to demonstrate programs that work and actually create change? A lot of our discussion focused on tensions within the various aspects of measurement. So looking at, tension within indicators, methodology, data, and whatnot. So I'm gonna look at my notes too. We talked about what donors want versus what organizations want versus what communities want, what they want and how they define what equality is. We looked at outputs and outcomes. We talked about sort of, wanting to, bring women up to the level of parity with men, but how difficult that is when men themselves don't have that many rights or that their status is suppressed. So knowing that there's much more to go beyond just being able to measure that women and men have the same opportunities and whatnot. We also looked at, the tension, we talked about this, between individuals and groups in seeing, how change occurs, not only with an individual and measuring that, but what sort of impact it has on a more community-wide level. And then we also looked at, we talked about how, we sort of have to be in the same conversation about, why gender equality is going to improve, other sectoral outcomes, right? So we have measurements for that, but what about the individual status, like of the person and their experience? Some of our recommendations that kind of came from that discussion of these tensions was ensuring that, measurement, whatever it is locally owned, that women are defining what equality means to them, right? And that it's going to be something that resonates to their reality versus what we're saying, what our viewpoint of equality should be. We also talked about understanding cultural differences and finding a way to measure cultural shift. So looking at norms and really taking a look at that, even if we are working with individuals, what parts are then shifting the cultural viewpoints. We talked a lot about measuring barriers. So, when we're developing a program, identifying those barriers that are in the way of equality, but really taking the time to measure what it looks like when those barriers are removed, right? And then, let me see if I got more here. We also, again, another type of indicator to determine success is, are these programs being replicated? Are they being embraced by other communities? Sometimes it's very hard to get to say that we've achieved gender equality, but in a sense, are these programs that are resonating with other communities within, a country, within a region? And then overall, we talked about just the expectations of change, that, measuring change needs to take a look at that process of change, that, a community, an individual, no one's going to change in the absence of feeling safe to do so, and also having trust with the project. So, looking and measuring in the beginning, is there that circumstance of trust and safety there before going further on to determine have we actually increased equality. I think that I probably have forgotten a ton of stuff.
Okay, thank you very much. That's great, thank you. And last but not least, table 12. Christy Getman's table.
I'm Daria Etazadi. I'm a rising junior at Georgetown University, and I'm with the U.S. Afghan Women's Council.
And she's a primary presenter, but I'll back her up. I'm Janae Bulat. I'm the Director of Teaching and Learning for International Education at RTA International.
So this tree is supposed to be an analogy for our discussion around gender synchronization and the means by which we can achieve that successfully. The first topic of conversation at our table revolved around gender synchronization and what that means, particularly considering that gender is a scope, and we need to understand whether we are addressing a binary male versus female population dynamic, or how inclusive are we trying to be in this discussion. And clearly the goal is as inclusive as possible. So at the root of this gender synchronization goal, we have the issues of intention versus execution. And we all start out with the same intention of trying to cater to different populations and make sure that we are promoting equality in different regions. However, in execution, we encounter a lot of pitfalls, which can become positives if we work around them correctly, but these pitfalls are centered on a lack of cultural awareness and an inability to, a lack of focus on educating ourselves in terms of what we're trying to achieve in a different region that we may not be familiar with. So in order to account for this, it's important to establish mutual respect, have a community centered on trust, make sure you're communicating, learning as much as you can about the norms and societal culture points in terms of the region you are dealing with. And in order to progress from that and understand how the obstacles and pitfalls tie in with positive benefits and make sure you are leaning more towards having successful outcomes, we put a lot of emphasis on potential successes and how we can turn pitfalls into opportunities for growth. In order to do this, we emphasize the need to share tools and resources with the community, make sure we are including as many individuals in the discussion as possible, particularly locals in the targeted areas, and not a top-heavy dynamic. So incorporating as many of the people you're trying to cater to as possible and amplifying their voices in that discussion. And part of this process would require funding, as many of the other presenters in this room noted. Donors are a key part in executing these visions, and to expand on that, just making sure you're networking properly and incorporating the right power dynamic, making sure you've got people who can advocate for the circumstances and people who can help execute your vision in the regions you're focusing on.
And I would just add, if we have time, just a lot of discussion around rights versus accountability, looking at comprehensive rights, not just at a slice of an individual's rights, how to integrate all of that within a comprehensive synergy building approach across sectors, across projects, across areas of focus within a project, and the need to continually monitor unexpected as well as expected outcomes, because unexpected outcomes could be very detrimental and actually impede progress toward the ultimate goal if they're not monitored and addressed carefully. And that all of this takes time. So we have a very large tree that takes years to grow because it takes years to build trust and mutual respect with the individuals we're working with. It takes years for us to understand the cultural complexities and nuances and the context in which we're working. And that cannot be accomplished without time and participatory types of research and activities to really understand the complexities that we're bringing to the table as well as the complexities that we're addressing.
Okay, thank you so much. Thank you. I want to congratulate you on amazing mind maps. I mean, just looking out around the room, very colorful. I want us all to give ourselves a round of applause again for your participation. Thank you.